Hello everyone, I am Erica Lea Navarro from 11D Group 15. In today's video, I am going to perform a return demonstration on how to assess thorax and lungs. So why we need to assess thorax and lungs? It is because to know the patient's complaint about his or her respiratory or the breathing pattern of the patient. So to begin with, we have a pre-introductory phase. So in the pre-introductory phase, we need to know the medical record or the doctor's order of the patient if there is any. And next is to prepare the equipment. So the equipment that we will be needing is, first is stethoscope, a centimeter ruler and a marker, a pen and a notebook, gloves and mask, and a towel. Our towel is alternate with a lab gown since we don't have a lab gown. So the last in the pre-introductory phase is make sure that we need to perform a hand washing and gloving to avoid a patient to nurse and nurse to patient cross contamination or cross microorganism. So, introductory phase. Introductory phase consists of establish rapport to the client, greet the client politely, introduce yourself to the client, and also know the client's identity. Next is explain the client how the assessment done so that the client will know how to participate during the assessment. And the last thing is ensure the client's comfort, privacy, and confidentiality, and make sure the client would distract or far from distraction. So that is the introductory phase. Hello sir, good afternoon. Ako tayo si Erica Lea Navarro, sir. Ako ang imong student nurse for today, sir. Pwede mabala nimong pangalan, sir?
Zain Arwen.
So, unsay prefer nimo itawag nako sa imo, sir?
Zain lang.
Sige. So, ang atong assessment for today, sir, is sa imuhang lungs ug sa thorax nimo. Ang kaning assessment para mabalaan kung naabay irregularity sa imuhang pagginhawa, sir, or problem sa imong respiratory. So, sa kanina assessment, sir, is nakaibuhaton like naay parts sa imong lawas na makita, mag-show kag skin, tapos patindogon ka, pahigdaon, and pa-bend, and mag-inhale, exhale, sir. So, okay lang ba to sa imo, sir?
Okay lang.
So, okay lang ba, sir, na isirado na ako ang pultahan?
Okay lang.
Okay lang. So, sir, reminder lang po di ay na kaning mga informations na makuha nato during assessment, ako o ubang nurses pa ma-assign sa imong ang future doctor nimo if ever na naay abnormal findings, kami lang makabalo, sir. And kami lang mismo ang keep ana wala na laing makabalo, sir. Okay lang ba to, sir?
Okay lang.
So, pwede na ta mag-start, sir?
Okay.
In working phase, the first is surveying the chest and the respiration. Observe the nasal flaring or signs and symptoms of the patient. Like in fingernails, if you've noticed a bluish fingernails, pale lips, or nasal flaring. And the next is palpate the suprasternal notch and notice the position of the trachea. Okay lang ba na i-remove na natin yung shirt? Tabo naman tayo towel, sir, para ma-cover ang sa front.
Okay.
Wala na akong matanaw, sir, na part. finger po. Sa kabila po. Examining the posterior of thorax and lungs. Inspect configuration. While the client stands and arms at the side, stood behind of the client and observe the position of the scapulae and look for the shape and configuration of the chest wall. Sir, tindog lang sir ha. Stand straight lang po. Okay, pwede na po mag-upo. Inspect for the spinal alignment for deformities. First is, from a lateral position, look for the three curvatures, which is the cervical, thoracic, and lumbar. Next is to assess the division of spinal or scoliosis, ask the client to stand up, bend forward at the waist, and stood behind and observe. Opo lang straight, sir, ha? Palihog lang po tindog, sir. Tapos, bend po forward. Sige po, sir. Hanggang waist po. Okay, thank you po, sir. Tapos, opo na po kayo. Palpate for the posterior thorax. Assess the temperature, the integrity of the chest skin. Next is palpate if there is any bulges, tenderness, or abnormal movements. Mag-touch ako sa skin niyo po, sir, ha? Okay po. Palpate for the posterior thorax for respiratory excursion or thorax expansion. First is, place your both hands over the lower thorax and make sure that your thumb is adjacent to the spine and your fingers is stretched laterally. Next is, ask the client to take a deep breath and observe the movement of your hands or any leg movements. So, sir, may nga lang kong inhale, exhale, sir, ha? Okay. Here you go. Inhale, exhale, inhale, exhale. Using mouth po. Okay, thank you. Inhale, exhale, inhale, exhale. Okay po, thank you. Palpate of the thorax vocal or tactile fremitus. First is, place your palmar of your fingers or ulnar, start from the apex of the lungs. Next is, ask the client to repeat such word like blue moon or 1, 2, 3. Next is, repeat the 2 steps by moving your fingers sequentially, starting from the base of the lungs. Start towards at the midline at the level of the scapulae. Next is compared on fremitus on each lung and between the apex of the base from the base of the each lung. So sir, pag every lapat sa ako ang fingers, sir, mag-state ka po ng blue moon, sir, ha? Sige, so start na po.
Blue moon, 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 blue moon,
Thank you, sir. Percuss the posterior thorax. Ask the patient to bend down the head with arms across the chest. Percuss the intercostal with about 5 cm or 2 inches in a systematic sequence. Compare the one side lang with other, and then percuss the lateral thorax starting from the axilla down to the 8th rib. So, sir, opo lang po ng maayos, sir, ha? Tapos, bend down po yung head. Tapos, arm cross po sa chest. Okay po. Bend po yung head. Okay. Measuring the diaphragmatic excursion. First is using the percussion to identify the level of diaphragm and measure the diaphragmatic excursion. Next is mark the full expiration of the client, then ask the client's permission if it is okay to put a marker on his skin. Next is ask again to client to inhale and hold it for a while, then start percussing downward from the level of the dullness. Then mark it. And the last is repeat the process on the other side and measure between the expiratory and inspiratory from the level of dullness. Sir, okay lang na butangan na kong marker yung skin?
Okay lang.
Sir, mag-inhale ka po for a while ha, tapos sabihin ko lang if pwede na ka mag-inhale.
Oh.
Sige, sir. Inhale. Exhale po. Lagyan ko din po ng marker sa kabila, sir, ha? Okay lang po?
Okay lang.
Inhale po ulit. Exhale po. Dali lang po, sir, ha? Ganyan lang po. Okay po, sir. Thank you. Auscultate for breath sound. Use the diaphragm of your stethoscope and firmly and directly put it at the posterior of the chest wall at the apex of the lungs at C7. Ask the client to take a deep breath using mouth. Using the ladder pattern used in percussion, listen to the expiratory and inspiratory. Last is compare the findings at each point and corresponding point at the opposite side of the thorax, and also note for the adventitious sound that is heard, as well as the full respiratory cycle. Sir, inhale, exhale lang po kayo, sir, ha? Gamit yung mouth lang po.
Okay.
Okay? So, auscultate for voice sound. There are three auscultate voice sound, where is the bronchophony, egophony, and whispered pectoriloquy. The bronchophony is ask the client to repeat such word like 99, and then the egophony asks the client to repeat such word like E. And then the whispered pectoriloquy asks the client to whisper the word 1, 2, and 3. So that is the auscultate voice sounds. So sir, pag magsabi ka po ng blue moon, repeat lang, every lapat ko po ng stethoscope, magsabi ka po ng blue moon, sir, ha?
Okay.
Okay.
Blue moon. 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 Blue moon.
Okay, sir, next po is sabihin nyo po, every lapat ko po ng stethoscope, sabihin nyo po na E, 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 3 times every lapat ko po ng stethoscope.
Okay. E, E, E. E, E, E. E, E, E. E, E, E. E, E, E.
Okay, sir, whisper po kayo ng 1, 2, 3. Whisper po.
Okay.
Every lapat din po ng stethoscope ko, ha?
Okay.
Okay po, sir, thank you. Now, we are proceeding on assessing the anterior thorax. First is inspect the breathing pattern, which is the rate and the rhythm. Next is inspect for the costal margin, which is the ribs enter the spine. Palpating the anterior thorax. First is use your hands to palpate the anterior thorax to know if there is any tenderness, bulges, or any abnormal movements. Next is move your hands to also use your hands to palpate the clavicle from left to right. Next is move your hands from the right, then move it systematically downward to the midline of the breast. Last is repeat the sequence in palpating the crepitus and fremitus. Sir, hand lang po sa side, sir, ha? Touch na po ako sa front niyo po, sa chest. the anterior thorax of the respiratory excursion, for the respiratory excursion. First is place both of your palms of your hands in the lower of the thorax and make sure that your thumb is along with the rib cage and your fingers is along with the costal margin. And last is ask the client to take a deep breath and observe the movement of your hands. Okay, sir, inhale. Exhale. Inhale. Exhale. Inhale. Exhale. Thank you. Percuss the anterior thorax systematically. Begin percussing in the clavicle in the supraclavicular space and proceed downward to the diaphragm. Compare the lung on the other side and lung on the other side. Okay, relax lang po, sir, ha? Auscultate for anterior breath sound, adventitious sound, and vocal sound. First is auscultate for trachea, and next is auscultate for anterior thorax. Next, and another is to begin with the auscultation for breath sound is use the diaphragm of the stethoscope firmly directly to the chest wall. Next is auscultate apices of lungs above with the clavicle to the base of lungs and the sixth rib. Ask the client to take a deep breath using mouth. Last is listen with at least one complete respiratory cycle and listen for the normal breathing or adventitious sound using the ladder systematic pattern. Check ko lang po, sir, ha? Pwede po tanggalin yung necklace, no? Check ko po, sir, ha? Tapos ngayon, sir, inhale, exhale po kayo using mouth lang po. Okay, start po. Okay po, thank you, sir. In summary and closing phase, summarize all the data that you gathered during the assessment and explain the client if there is normal or if it is normal or abnormal during the assessment. And also gave advice to the client to avoid the increase of his or her condition. And thank the client, and the last is apply hand washing. So, sir, tapos na tayo nag-assess, sir. Lahat naman po, wala naman pong wala may nabantayan ng mga abnormal findings, sir. Sa alignment, sa imong spinal, sa diri sa may trachea nimo, sa imong collarbone, wala may problem, on normal tanan. Sa imong skin, wala may problem, moisture man, wala dili siya dry. And normal man po ng temperature, dili po siya init, dili po siya kaibong na, tama lang. And sa respiratory excursion, sir, thoracic expansion, nag-expand man, to nag-inhale, exhale pa, kuan siya, nag-expand siya, tapos nag-palik, sir. And ang next, sir, is sa imuhang breath sounds, wala may problem ato, normal tanan. Sa imuha po voice sounds, wala yung mga abnormal findings na nakita, like sa kanang mga cricket, mga crackles, mga wheezing, wala may nakita, sir. Pag istorya nimo og tong 99, katong na ang gipay mo, sir, 99, E, o katong 1, 2, 3, clear man, wala may, dili man siya murag kanang naibabag, clear ang, kung unsa tayo mong ginastorya, clear po, no, po ang ako ng dog, so it is considered normal po. So, sa duga na part, sir, sa pag-check na ako ganina, wala ako na bantayan na any tenderness, ang mga bulges, sir, o mga abnormal na mga movement. So, normal tanan, pati sa imong trachea, wala man. And sa imuhang spine, connected sa spine, sa mga sternum, o sa imuhang costal margin, sir, is tama siya, wala abnormal findings dito, O sa breath sounds, sa adventurous breath sounds, o sa mong voice sounds, normal tanan, dira sa mong dughan na part, wala abnormal findings ato, sir. So, ang ako lang advice, sir, if para maka-avoid po tayo magka-cause o mga sakit sa atong lungs or maglisod ta ginhawa, mag-avoid lang siguro ta sa mga smoking area, kanang mga nagadaog og kanang plastics or guma, iwas lang tana para di ta makalanghap og mga bahod na kana maka-cause of damage sa atong lungs. Kung naa pa kay any concern, sir, feel free to ask me, sir. Not kay any question, sir. Wala na, sir. So, salamat kayo sa pag-cooperate, sir, ha? Sige, sir. Thank you. That we are done in our procedure, we make sure to do hand wash to avoid the cross-contamination from the patient to nurse. Thank you.